the needs of the patient comes first. That's the motto Mayo lives by. However, when it comes to billing and debt collections, that motto rings hollow for a large number of patients. But not for Minnesota Attorney General Keith Ellison, who's conducting an investigation into Mayo's questionable practices. That investigation settled today. ABC 6 News reporter Chandler Jackson has been looking into this for us and joins us live now tonight. And what have you learned today, Chandler?
Yeah, Robin, the settlement now requires Mayo Clinic to streamline and expand its charity care operations. That's where the hospital either fully or partially covers the cost of care for patients who can't afford it. Patients like Roger Daniel. Roger suffers from high blood pressure. Just last year, while he was living in his car, he had to visit the ER here at St. Mary's because his pressure was dangerously high. There, he says he was signed up for the state-provided health insurance, MNsure, which helped cover that emergency visit, and was told to schedule a follow-up appointment with a cardiologist. Within 24 hours, he says he received a phone call from Mayo's billing office.
Looked it up and they said I don't have insurance. So I told them that there's a number they're supposed to call, and all they wanted was a $2,000 deposit for me to be able to see the cardiologist.
The Attorney General's report says it discovered several similar instances that allegedly violated the state's hospital agreement. The report claims in some cases employees were told to actively avoid discussing charity care options to patients. Mayo Clinic is denying a number of the claims made by AG Keith Ellison, telling ABC 6 News in part, Mayo contests many of the findings reflected in the report, and Mayo did not agree to include them in the settlement agreement that is formally filed with the court, because those findings are inaccurate, speculative, or are irrelevant to applicable legal requirements. Now, for its part, Mayo Clinic has improved its charity care access, more than doubling the amount of money it has provided for patients between 2022 and 2024. Now, as for Roger, he has since seen another cardiologist and says he's doing much better now. Live in Rochester, Chandler Jackson, ABC 6 News.